State health leaders are seeing a small step of progress when it comes to containing this virus. Today they showed this chart. It shows no numbers or data, but it got our attention because this is the first time the state has not had a red X in any of its 4 key trends in more than 2 months. Still, we didn't see any green check marks, which ultimately is what health leaders want. Dr. Mandy Cohen says she's encouraged by the progress, but vigilant.
Seeing glimmers of potential progress does not mean we can let up. It means it's time to double down.
The improving trends are not enough to get North Carolina off the White House red zone report. North Carolina is one of 21 states listed as high risk. Now, because of the spread, the report suggests that those states close businesses where social distancing and masks do not frequently occur. The example they give is bars. In the summary, it also lists Mecklenburg County as having more cases than anywhere else in the state last week. And it's not just cases, it's hospitalizations also up in Mecklenburg County. Today, the county set a new record in hospitalizations, now at 210. This is only the second time it's been above 200 and the first in nearly 2 weeks. New data shows about 1 in every 20 cases requires hospitalization. Those numbers were presented to some frustrated county commissioners today. Health Director Gibby Harris expressed concern that they would not be able to test the state's goal of 12% of the population by the end of the month. And today, some of those commissioners made it clear that they are not pleased with the county's response.
I believe that we are falling short of the mark. We are falling short of the mark as a board, and we are falling short of the mark as a county.
When they ask me, what is the number? What is it that we're going towards? I just don't have anything to give them. That's very hard.
And now we turn to South Carolina. It is also one of those 21 states on the White House red zone report, but the Palmetto State is seeing some improvements. The report says the state has seen stability in new cases and a decrease in the percent of tests that come back positive. But still, more work needs to be done. The report says there are 242 new cases per 100,000 people. The national average is 140. The report lays out a few recommendations, including shutting down evening entertainment venues, going back to only outdoor dining, and mandating the use of masks.